Hi, I'm Sam Solomon, the host of Signal Tower, the show where we talk about everything startups, design, and education. Today's guest is Rashad Abdul-Salaam. He's the founder of HappyHealth, a healthcare startup focused on personal health records, and he is trying to make healthcare suck less. Rashad, welcome to the show.
Hey there, Sam. Glad to be here.
All right. Well, let's begin the show. Why don't you tell us a little bit about yourself?
Well, I a little bit of a late bloomer, admittedly, to the tech scene. I am in my early 30s. We'll leave it at that. But kind of, what kind of really, sort of got me into technology. I was kind of really into tech back in sort of the mid 2000s. Unfortunately, there weren't a lot of the things, where we met, like Starter League,
Right.
to be able to really kind of get into the scene. But that's sort of right around '05, '06. I was originally trying to like start a politics website, and I actually remember applying to like the very, very first class of YC, but wasn't didn't have the technical skills to really get in. But that's when I started really realizing, tech was awesome and sort of tech was cool. Sort of on the side of that, I've been kind of a education rat. Got my bachelor's, then got a master's, then just recently got an MBA. So what is that? Education inflation. I am the spitting image, kind of the sort of modern generation of that, and basically, I kind of got into healthcare right around '06. I actually sort of just really stumbled into healthcare. I had my BA was in psychology, master's was sort of like in social science, and then used those skills to get into what's basically called intraoperative monitoring, which is a way to kind of basically monitor patients while they're anesthetized during surgery. So we have these technical electrophysiologic techniques whereby we can continuously test your nervous system while you're anesthetized. And we're like an early warning system for physicians. And so I've been doing that since '06, full time, still admittedly working full time. As I say, that's my Bruce Wayne job. Got my MBA during that. Also during that time, I basically thought, I was going to come out and do like healthcare consulting. Thought I wanted to be a, mid-level administrator, manager, what have you. But right around when I was graduating, we took a trip to London to basically look at the healthcare system in the NHS in London and in Germany. And I was looking at a company, Cell Novo. And what they were basically doing is sort of healthcare analytics. They built a separate kind of mobile device. This has obviously gotten really big now, but for people with type 2 diabetes, it's basically a way to capture a lot of these analytics and, graph it over time over the internet. And that just really kind of like that whole concept has really sort of hit me like a ton of bricks. It is a cool way to sort of use the internet, use modern technology as a way to sort of better healthcare and capture innovation. And so I kind of came out of that trip saying healthcare analytics is going to be big. This is right around 2011. And then I graduated and, was trying to apply to be a consultant and what have you. And, the MBA helped you keep my resume sort of on the desk, but I didn't have, 5 years experience as a
Right.
project manager, et cetera. But I started getting back into reading everyone's favorite drug tech blog, TechCrunch. And right around fall 2011 is when there were a number of healthcare startup incubators coming out, like Rock Health, HealthBox, Blueprint Health. And so I wanted to really, apply to those because, I knew anytime there's something new that comes onto the scene, sort of the barriers are lower. The barrier for entry is kind of lower because, it's a first time thing, the quality of the applications, et cetera. And so I kind of just one off, was like, what would be cool for mobile phones in healthcare? And that's when I came up with an idea for a company, SkinClick. And the idea was basically a way to take pictures of rashes and securely send them to a physician remotely to basically save you as a user, having to come in typically, you go in for something minor. You obviously don't know it's minor, but you go in, you have to maybe take a day off from work, half a day off from work. You're
Right.
in the waiting room 2 hours. You go in, and then the physician may only look at you for 10 minutes and then say, here's a skin cream or something like that. Take it for 2 weeks, and then, we'll do a follow-up. And so I said, why not utilize mobile technology? Actually, I remember now that there was a Chicago company that really sort of inspired that idea, a company, Body Shop Bids. And their sort of idea was taking pictures of dents on cars and then sending it to the cloud and then having auto body shops bid down. And so that concept of, taking a picture of something that, is injured or damaged and remotely sending it. So that's kind of where SkinClick gelled. And I was able to get a small team together early 2012. We entered a lean startup machine in Chicago and actually ended up winning.
Awesome.
Yeah, for the Chicago version of that. But, as with anything in entrepreneurship, that was the high, then kind of hit the low because, what happens? You go to speak to the attorneys, and then they kind of throw cold water all on the idea.
Yeah.
Obviously, within healthcare technology, everyone's favorite acronym, HIPAA, being a big issue, sort of how do you secure these things. But also a really big challenge that I hit with that was, obviously it's something that a lot of, people really like. The American Telemedicine Association, they say their statistics are when they ask people about telemedicine, it's like 80, 90% are really in favor of it. But from a physician standpoint, and this is kind of something I'll get into more later, they're really obviously hung up on things like liability
Right.
around HIPAA, but really also reimbursement, which is basically how are they going to be paid for this. And again, we'll probably get into this more, but healthcare is really dominated by reimbursement, either through the government or through
Insurance companies.
private. Yeah, exactly. And so there isn't a huge model of this sort of open free market, pay system. Well, there is. It's probably under the table.
Well, let's save a little bit because these are some of the questions I kind of have for later, where we can get more in depth about HIPAA and doctors worried about how they're going to get paid.
Sure.
Why don't you tell us a little bit about your startup right now, HappyHealth?
Okay. HappyHealth, we kind of got the idea, and that's a good segue. So while I was going out and speaking to physicians, I was looking at a lot of their websites, and I noticed that they were having people register. They still had PDFs, and I was thinking, well, why isn't there just a database, for me to kind of like log into or what have you? And so right around summer of last year, there was the Chicago Lean Startup Challenge, and I spent a lot of last year going through a starter league, partially when it was still called Code Academy. Started really getting my chops up on front-end development, back-end development, obviously where we ended up meeting. And I met a co-founder for HappyHealth through that. And we were just kind of really gelling around this idea of, personal health records, PHRs as they're known in the industry, and was kind of thinking about how do we gel the idea of a personal health record is where you're going to store your information and then use it as a way to kind of take care of all this paperwork that's being done and registration. And it was kind of looking at this idea of, I go see my primary care physician. They're asking me, name, address, phone number, insurer, emergency contacts. Write that all down on paper. Then you go to your dentist. They're asking you name, address, phone number, dental insurance.
The same thing.
Yeah, go to an optometrist, name, address, phone number, etc. And so we were saying there has to be, a better way. And this was, when I started noticing a lot of the apps, you're logging in through Facebook. So I get a new app. I don't have to get a login, get a email, etc. I just push login with Facebook, login with Twitter. Boom, all my stored information is, funneled through, authenticated, and now I'm in the app and working. And I was thinking, how could there be maybe a login with Facebook for healthcare? And that was kind of sort of the high concept pitch for Happy Health, basically using the personal health record as a way to store basic information and then using that stored information to autofill registration forms to kind of take a lot of this sort of redundant paperwork out of the system. And so the problem kind of going after is sort of the redundant paperwork issue. And also there's a really big issue within healthcare, portability of data.
Yeah.
You know, right now, I mean, there are efficiencies slowly coming along, but still for a lot of ways, if you go see one, you know, a primary care physician, and then you have to go see a specialist, you know, fax machines are the cutting edge,
I know.
state-of-the-art way to transfer data. I'm sure with your experience in Dr. Chrono, you know, using email to communicate, we might as well be talking about going to the moon or something
Right.
like that. So that's the primary means of communication, and thought Happy Health could be a way to kind of segue that, get that, you know, that onboarding intermediary process, kind of attack that again by using a protected, stored data solution to kind of, you know, funnel that data through.
Right, right. Yeah, I remember. So I used to work for Dr. Chrono, which was a Y Combinator healthcare startup that work focus was on electronic health records, which was really kind of the doctor side of it. And I remember when I first got there, I was like, I don't understand why people aren't emailing these things. And that was like, no, that's a big no-no. You have to fax everything, which that just kind of like blew my mind. Like, you rarely see anybody fax anything anymore, and yet the whole industry is running off of fax machines. So, yeah. So right now, let's take a segue and we're going to take a look at. You're going to give us a demo of what Happy Health looks like, and it's in its beta right now, and limited invites, right?
Yeah.
So we'll go ahead and we'll take a break here, and we'll go take a look at that.
Okay. So this is going to be the demo of the Happy Health functionality, and this is the first page that you would see. Now this is assuming you've already filled out your information, and you can see obviously you've got, you know, personal information, your name, etc., what have you, and we have tabs for emergency information, your contacts, also some insurance information that you can view, and then finally medical information, sort of like allergies, medications, etc. And all of this information can be edited. And so you can see here, you can change something. You can change it from Dr. Phil to Dr. Sam Solomon. Maybe it's OM. And, you know, obviously we can save that, and then you can see that's there. And so this is basically the health profile where you can store all your information, etc. And here, the part that we like to think is sort of the cool part, this is our office registry. So the idea is you have an appointment with a physician, you can come to our website now and find their forms. You can view the form. We give you a nice overlay so you can look at your information as it's overlaid over the forms, make sure everything is correct, what have you, getting a little bit of internet lag here. And if there's something that you're looking at and saying this includes, you know, all the privacy stuff and everything that you would have to sign, it's already set up and dated for you because, you know, again, we want this to take the redundancy out of things. And so if you like what you see, you can basically click continue. You go to download the PDF. You agree to the terms of service privacy policy. Hit the agree button. Our magic elves in the background do their magic to prepare your form for you. And then you can basically, more internet lag here, you can basically pull up the PDF. Going to open for me? There we go. You basically pull up the PDF now, and, you know, again, it's primarily filled out for you. All you have to do is print it out, sign it, and what have you. You can you leave off any information you aren't comfortable about, as you see here, your social security number. So if you want to have control, you don't want your social security number there, you can print it out and then write it in on the day of your visit to bring in with you. And so then we can see now, you can go look at another office here and see again, now there's another office and your information is already filled out for you. And so now this is, if you're in a scenario where you have to see a number of physicians, again, you're going to see a primary care physician, then you have to go see a specialist or what have you, and then a dentist. The internet connection is a little bit slow, but we also have we can do this for dental forms also. This is basically using your stored info to save you a ton on all of this paperwork. And so, we've been building this for the last couple months, tested it out with close family members, myself, and, the general reaction from receptionists is, they like the fact that the forms are neater. They don't have to deal a lot with, they don't have to deal so much with bad handwriting, what have you, and it helps them sort of on the transcription side. And so we, again, we're in beta, and we, part of this is to kind of get the word out and have, invites. If you're somebody who either you yourself has to see, for whatever reason, a number of physicians, and you have to deal with a lot of, paperwork that's annoying, this we think is the product for you. Or if you have a loved one, like an aunt or grandparent or something like that, or older parent who has to see a lot of physicians, and you're the caregiver that's managing all of this work, this is the product for you to kind of take away a lot of that paperwork.
All right, and we're back. Thanks for that, Rashad. It looks good. I do have a question, though. If you have, say there's a handful of offices and you'd like to add another, is there a way to do that?
Yes, I didn't get to show that, but we do have basically a request office button, and you just press it, and we can actually autofill and email. And basically what we would need you to send is just sort of the name, three things, kind of the name of the physician that you're going to see, because appointments, a lot of times they're scheduled 2 weeks out, 3 weeks out.
Right.
So just the name of the physician, the phone number of where you'll be having the appointment, and the date, and actually the name of also the medical office, because sometimes the offices aren't named after the physicians. And we need probably about 3 days. We do have a system where we can kind of crawl the web and find this information. That's kind of sort of I think the good thing about this, as I said, a lot of these forms kind of are readily available online. We have a way to crawl the web, kind of get them. Right. But because healthcare isn't up to speed, not all doctors' offices are up to speed, we may have to utilize Meet Space to actually go out and find the forms and maybe actually call an office or what have you. But, we're trying to sort of match supply and demand. We are on our own in the back end adding offices, but we also want people to be able to request an office to be added, kind of a user-generated content sort of thing, sort of fulfilling demand as needed.
Right. All right, great. Well, let's kind of get into the meat of the interview. I'd really like to talk about, kind of the healthcare tech space specifically. And so I guess let's start by, what barriers do you see to starting a healthcare startup? What opportunities do you see in the space?
Great. Well, the thing that I think a lot of people, initially this is, sort of what got really just me jumping is, there's a huge delta between, great innovations that consumer tech has been able to create, with a lot of just real-time messaging. There's 50 different ways I could contact you. We've got, I can email you, Google Hangouts, I can Skype you, I can text you. There's so many ways in which I can communicate. But in healthcare, I can call you, I can fax you, emailing is too new, or I can mail you letters. And so obviously a lot of people look at that big gulf and say, wow, there's so much opportunity. And there is opportunity. But what I've seen, you kind of hit these walls. One of the big ones obviously is being HIPAA security. It's basically, health information portability and Affordability Act. And basically it's a way. Basically they're just standards that define, how you can share data, and basically, do you have sort of the risk management protocol set up for if there is a data breach, if you're going to fax information over to someone and it ends up getting faxed to an auto body shop or something like that. Do you have a process in place to disclose that and to also clean up the security hole, et cetera? And the problem that HIPAA causes a real big chilling effect, I think, within the industry on adopting a lot of these cutting edge methodologies. And so that's kind of where there's a big quicksand in not being able to use a lot of these messaging, sort of these cutting edge messaging systems. There's really a lot of confusion about what the exact, HIPAA standards are and what the exact meaning of things are and what the exact interpretations of HIPAA are. And so there's just a really big chilling effect there. So that's kind of one big barrier. Now, HIPAA is obviously speaking to privacy, and that's on the provider side. But then on the user side, this is different for generations, but people are extremely protective, of their healthcare data. From a philosophical standpoint, again, you look at the opportunity. There's so many great things that we can do in finance now, things like Square,
Right.
One of my favorite coffee shops. I just go there, push a button, don't even take out my wallet or a credit card. My picture shows up. We can buy, they give me the cappuccino. I take it and then I just walk out. And the idea is, why can't there be an experience like that? And in finance, obviously they deal with highly secure data, but obviously we have so many more methods.
Right.
We can transmit the data. But I think because, not to get too philosophical, but because healthcare data says something much more transparent about who we are, there's definitely an idea to want to protect that. So now, as a younger person, we may say, well, who cares if I have a heart murmur? Granted, but we certainly wouldn't want anyone to know if I have erectile dysfunction, wouldn't want that to get out on Facebook.
Right.
If I have an STD, definitely do not want that to get out on Twitter. And so those sorts of things. And, because healthcare data, we only use sort of healthcare data in certain situations, obviously not nearly as much as we use financial data. So the industry has had to set up all these protections.
Right.
I look at my credit card, I can hop on a phone, 1-800 number, get my old credit card swiped out, get a new one. We don't have all those protections set up for healthcare. So healthcare is still very vulnerable. Those things are coming. So there's sort of the attitudes about data. Other things just going to be along with that from the provider side. There's regulation, liability. One of the big problems with regulation is that it really, in terms of being a quicksand, it really restricts your degrees of freedom in terms of kind of what you can do. A big thing that happens with, startups when they're partnering with merchants, there's a lot of, back and forth referrals and things like that. But in healthcare, when you're partnering with a private institution, there are things like Stark law, meaning, it's gotten to the point now, as I said, I work in a hospital, as a company, I can't have an appreciation dinner for some of the staff that I work with, because that could be looked at as, using money to induce the provider to, shuffle their patients towards, using our services. And so there's really lots of restriction there. Added to that, how, as I said earlier, how we're paid, how providers are paid. A lot of it is through insurance and, through government reimbursement. So there aren't a lot of degrees of freedom of how you can kind of, quote unquote, play with money, or
Right.
we'll say innovate around the transactions. And again, so there's a really big barrier. The regulation it really restricts a lot of what you can do, and it really restricts a lot of providers' thinking and freedom in terms of creativity on how they can innovate on business models. So, when you talk about, when I was sort of talking about Skin Click, the big thing was, how am I going to get paid for this? There's no office visit. Is insurance going to cover this? And then, and so then obviously, they're kind of the ideas, no, it's not directly going to be paid by insurance. It's going to be paid directly from a patient. And then, a physician has an idea of what a virtual office visit should cost. A lot of what we're getting is they think a virtual office visit should be $100, but a patient thinks a virtual visit should maybe only be about $30, kind of the cost of a copay.
Right.
Which is sort of really the only kind of money that I think people really think of when they think about paying for healthcare in a salient sense. So that delta is going to have to be, filled probably by insurance again. But that kind of gets into a patient side, sort of our own attitudes about healthcare. Obviously, in a theoretical sense, we can obviously say healthcare is one of the most important things in our lives. But I think that's only really true when our healthcare is immediately in danger. If we're injured, obviously, or if we're suffering from a condition, obviously that's going to be top of mind. Getting to the physician's office, making sure you're getting all the tests. But regular other times, particularly around young people, and not even just young people, and I think this is kind of a sort of a big secret, but that we really kind of need to think about. People just really aren't engaged with their own health care, and to a certain extent just kind of really, don't care. But it's maybe not just don't care, but I think from a philosophical perspective is, one, healthcare experiences, it's a bad user experience. We talk to people, one of the first things they say, I hate going to the doctor.
Right.
And when you think about it, you think going to the doctor, what are some of the things you think about? Painful scenarios. They're going to poke you with a needle. They're going to tell you you're overweight, you need to eat better. A dentist is going to want to drill your teeth. So we have all these painful associations with healthcare experiences, on top of the fact that, again, there really isn't, healthcare, so not only do we have bad experiences, but healthcare makes us think of our own mortality, which isn't a fun thing, to think about.
Right.
And so I think there are a lot of these kind of. I am a psych major, so I am kind of doing a little. Psych
but I don't want to get too off track here. But you're talking about.
Definitely.
Yeah, I understand that the doctor is not a lot of fun for people, but yeah. I know that it's a good segue. I know that you guys are planning on utilizing gamification with HappyHealth, and I'm curious. How do you plan on implementing that?
Well, we kind of put it bluntly, everyone knows gamification is out now. And so this kind of does segue in opportunities. What I'd like to rather say is sort of behavioral reward systems. And I think we're really starting to see that. There's a lot of companies now that are setting up systems with people's employers to basically provide rewards for, if you enter this running contest, you will get these certain amount of points that you can use for getting an Amazon gift card or something like that, or buying videos on Amazon and things like that. In terms of HappyHealth, we're, again, not in the very midterm, and we know, because these are sort of forms, and this kind of goes back to engagement, we know forms are boring. And so we think there are a lot of opportunities around design to really sort of get people engaged behind kind of really caring about their health at the end of the day. And so I think that's going to have to be a really big opportunity of, pairing, do this behavior that is going to help advance your health and get some sort of salient reward. Right. And again, we're seeing this in employers now. Where I work, at the hospital where I work, they have a system now where once a year they'll take my blood pressure, take my waist measurement, BMI, etc. And if I'm able to stay at or under that the next year, my premiums that are taken out of my paycheck are lower. Now, I question if is the receipt of that reward close enough in time to sort of doing the action. And I think those are sort of the tests that the
Right.
industry is going to really bring out. But, again, to kind of summarize a lot of the challenges, I think there's going to be, there are barriers in terms of how providers sort of really think about things. The providers are not, they don't really understand kind of sort of this lean, agile methodology within software startups. So,
Right.
startups, you want to find a really small problem that you can kind of cut out and then optimize on that, fix it, make it work. But providers, because there's so many different touch points in healthcare, they kind of want these full stack solutions. So figuring that out, I think the key solution is, as a startup, you really have to show where is there going to be value. It has to, healthcare is not like technology where, we get a nerdgasm at innovation for innovation's sake. In healthcare, it has to be, what is this innovation going to do? Is it going to cut down costs? Is it going to help, generate revenue? Healthcare, it does have a lot of metrics,
Right.
but going back into sort of the regulation, healthcare metrics are really defined by regulations. So there again, and degrees of freedom, you can't really sort of like make up a lot of these metrics the way maybe you can in sort of the e-commerce sharing sort of department, or like Amazon, where you can kind of make up these peer-to-peer systems and sort
The
of make it up.
metrics are already defined for you from the regulations. You can't really choose. Yeah,
Yeah,
that makes sense.
yeah, you have to find out what those regulatory metrics are, and then use some of these sort of e-commerce or analytics tools that the consumer industry has developed and optimize those. And because the big change that is happening, with healthcare reform, I think there's going to be a ton of opportunity actually for startups, because this has been a big shock to the system.
Right.
And the biggest thing is that the system is going to be changing from a fee for service, which is a do more, bill more, give me another MRI, pay for it. I have a procedure which I paid for. I get an infection, I have to go back into the hospital, I pay for that.
Right.
More towards, here is, $20,000 for a surgery. You figure it out, you split it up between the medical staff. If within 30 days that patient comes back for an infection, you're not going to get, that payment. So the incentives now are on the provider to actually look at outcomes,
Right.
and being really focused on outcomes is going to turn a lot of the focus now onto these metrics, and just sort of really rattle off one of the three big areas where I think there's going to be a lot of opportunity. We talked about behavioral reward systems,
Right.
health engagement. I think data sharing is, once we kind of get the plumbing going on that, that's going to be big, because I think that's going to open the door to telemedicine, which, Skype, HIPAA compliant Skype for doctors, as I
Right.
like to kind of think of it on a high level.
Well, can we go back to, I guess, kind of HIPAA for a second? So for someone that's looking to get into the healthcare space, specifically, what will they have to do to comply with HIPAA? Like, I understand, you have to focus, it's phone calls, letters, and faxes. But like, so what, specifically, I guess, what for someone trying to get into the healthcare tech space, I guess the best thing to say is, where can people go to learn about, how, if they can be HIPAA compliant?
Well, and again, this goes to sort of a lot of the confusion behind it. The government does, have a website available where you can kind of look this information up. I don't actually know it off the top of my head, unfortunately. But a lot of the basic things, that you need, you're going to need, obviously, SSL. You basically have to be able to protect the data as it's in transmit. You have to protect it while it's at rest. You have to have protocols set in place, like automatic logouts for, if I have a patient's record open,
Right.
after 90 seconds, if there's no action, it automatically logs you out. You have to have, methods to authenticate a user. You have to have audits available so that, I can know who logged into my account, when they logged in, et cetera. It's kind of a lot of those things around there. Now, what's great is services like Amazon, Amazon Cloud, from a technical perspective, they have put it out there. They have a white paper that says, they protect their information and protect their servers. That's another thing. You have to be able to have redundancy,
Right.
if you lose records, etc. So it's not impossible. It does take a lot of, work to sort of get through it. But that's the other thing. A good place for the opportunities is you're going to have to partner. So if you're partnering with a provider, in the appropriate way, they will help you, through a lot of these issues.
Right.
Now, and so, yeah, I mean, HIPAA is always going to be the first thing, again, like we said, that people talked about. And you're really going to, again, have to do your research. There's not only the technical component, but there's also an interpersonal component. And these are just going to be business practices.
Right.
If you're having patient data, coming into a fax machine, make sure sort of the person who's right next to that, data on that fax machine isn't, looking through people's data when they shouldn't, when they shouldn't be.
Right.
And things like that. Or make sure, however you can, people aren't, in order to get extra work done, taking patients' information and putting it onto a key fob, and bring it on a laptop and leaving that laptop in their car so the laptop can get stolen. There's a lot of interpersonal things, which I think are honestly the real issues behind HIPAA. Don't have the login and password taped to the laptop. Now, these, for the tech savvy folks, these things are going to be obvious, but you do see this within hospitals. Why? Because we are human beings. We don't like to have to remember a lot of passwords,
Right.
etc. So
It's understandable.
Yeah.
So let's talk about kind of you. Like, what is your, HappyHealth early stage startup? What does the average day kind of look like for you?
Well, leading up to sort of this kind of beta invite launch, it's really admittedly been doing a lot of sort of rapid coding and, testing. I've been, again, with family members, going to physician offices and really, testing this idea of, if you sort of partially fill out forms and give them to receptionists, are they going to be, happy with that? And, it has been sort of a resounding yes. And as I said, a lot of receptionists are glad that they have been filled out. And I've just been really, trying to optimize around sort of slowing down kind of or speeding up the workflow process of,
Right.
Getting these forms, digitizing them, storing the data, pulling it, et cetera. And then also reaching out, sort of doing a lot of kind of outbound marketing, blogging, kind of getting the word out there, using social media, et cetera, to kind of really get the ideas going, and kind of the hype and the knowledge out about it. Again, I really think lean is just a great way to look at building startups,
Right.
building companies and building functionalities, because it really forces you to scope down and make sure your product isn't over bloated. So I'm doing a lot of that, thinking what features to be able to take out, and just really how to get the product into enough of a package such that we could put it out and see if it can add value. This is admittedly, this is a moonlighting sort of deal. So the days are going from coding to doing designing to watching a little cable, sending out some emails, doing a little more designing, wearing a lot of hats.
Gotcha. Well, so far, is there anything, like, looking back that you wish you would have done differently?
It's, admittedly, I wish I would have learned how to code at 25.
Well, that's absolutely fair.
I really wish a lot of these tools were available back when I was 25. But in terms of the business, I would admittedly say, honestly, not really, because the thing with lean is you have to learn. And
Absolutely.
I would say as a company that's starting out, you know, so there's the idea of, do you go to direct to consumer because, that's obviously what's sexiest because there's, the biggest market. It's a very visceral sort of thing. And you can
Right.
theoretically get a lot of feedback from people a lot faster than, trying to go and, pitch to a physician, see if they'll hear you out, et cetera, et
Right.
cetera. Um, so I mean, I honestly don't think I would, admittedly, have done a lot different. I think the path that I've been on has been a very, I've learned a great deal, and I'm up to the challenge to learning more. Now, that is to say, I do realize, a lot of the monetization behind this is going to require partnership, as sort of as I was saying, where the opportunities are going to come
Right.
from. And so I am in the process now of partnering with a local startup that's also in the same area of trying to deal with registration and digitize a lot of the paperwork. Their name is MD Leaf, and they were focusing more on the provider side.
Gotcha.
And because, healthcare is just this big dragon that really needs to be slain by 1,000 cuts, we're really, we know that two heads are going to be better than one. And looking at both sides of the market and seeing where we can kind of, provide value, because I feel like a lot of the best companies that are sort of out right now, like the Ubers, like the Squares, even ZocDoc, which I think has a really good model, they partner with merchants, or partner with sort of the entrenched small business, and then use that, or they offer some value, some sort of value to the business, and then they use that as a way to open the doors to the consumer to really sort of drive utilization and have win-wins on both sides. So that would definitely be a piece of advice, for a healthcare startup is look where you can really look where you can see the win-wins. We're not at the point yet where computer algorithms can completely eradicate physicians
Right.
and diagnoses yet, and so right now it's really going to be about partnership, and it really should be that way because we don't really want to scare physicians off. However we may feel about physicians, they're smart. They see what's going on with DVDs. They see what's going on with the music business, what's going on with music, and things of that nature. And a lot of them do feel, at threat. And
Right.
so there need to be partnerships again so that there can be win-wins. So,
Understandably so. We've got a little bit of time left. I do want to kind of dive into one more conceptual thing before we kind of go into closing questions. There are a ton of interesting things happening with the quantified self movement. People are working on tools that, kind of allow you to do things, healthcare analytics, help people check their blood pressure, their blood sugar, kind of monitor their own vitals. What role, I'm curious kind of what role you think these technologies will kind of, how these technologies will play out.
I'm obviously being an entrepreneur, I'm very optimistic on it, particularly in the long run. Again, as these things sort of get absorbed into the industry from the provider side and they kind of, start to understand a lot of where the value is. I think quantified self is really interesting in the short term because it's something that's decoupled from the industry, meaning, I wear a Fitbit, it's tracking my own running, my own steps. That's something I can manage and I can control and I can derive benefit from, as opposed to something like telemedicine where you need an interface with a doctor's office or a provider, meaning you kind of really need to get permission. So I think quantified self is really interesting. And then, if you think about it from the perspective, you go see your physician, they tell you need to eat less. or eat better, the doctor's office is not calling you every week or every day saying, "Did you eat your apple today?" Um, that's where, quantified self and self tracking can help you do that to manage on your own. And I really think that is ultimately going to be the solution. One of the big solutions to healthcare is us just making better life choices.
Right.
I actually don't know a lot of I don't have the statistics on me, but something like 60%, of a lot of the problems where money is going into in terms of healthcare is based around things like life choices and chronic conditions. And so, 2/3 of the American people are, overweight or obese. And that really, at the end of the day, comes down to behavior change. Your physician can tell you what to do. They can give you recipes. They can give you a link to a Pinterest, pin board that has all these great looking recipes, but it's up to you to cook them and track them. And so,
Right.
And like I said, I think quantified self can really put a data layer there so that, once there becomes trust in these things, I definitely think there will be a point where we will be able to trust, people measuring their own weight, their own blood pressures. There's a company that I just backed on Indiegogo because I think it's just so cool. Scanadu. They're basically trying to create a tricorder, and they have this little device that basically you're going to be able to hold it up to your temple, hold it there for 10 seconds, and it measures five things. It's like blood oxygenation, blood pressure, a number of things. But what are they doing? They're going through the long, hard slog of getting FDA approval,
Right.
Which they really have to do, so that people outside of those who are super ignited by quantified self, regular people can feel, does this work? Is this trusted? Can we use this? If that's something like that is going to be used in a doctor's office, if they don't have to put a blood pressure cuff around your arm and look in your ear, etc., it's going to need FDA approval. So I'm, really big on quantified self. It reminds me of kind of one of the last point you have to do if you're going to be a startup. You got to be in it for the long haul.
Absolutely.
These are going to be 10, 15-year businesses. ZocDoc, I go into the industry and ask physicians, they've been around since '07. A lot of people haven't heard it. A lot of physicians, a lot of people in the industry haven't heard of ZocDoc.
Right.
A lot of companies that we're just starting to hear now, they've been around since '99. I was looking at pitches during the first bubble of healthcare companies. You wouldn't know, if you didn't know that this was a blog post from 1999, the exact same things we're trying to do now. Portals so that patients can connect with physicians and put in information, etc. There's not going to be an 18-month, I try to never say never, but there's not going to be an 18-month Instagram.
Right, in the healthcare industry.
Yeah, unfortunately, it's going to take some time. You got to be in it for the long haul.
Right. All right, well, kind of wrapping up here, books entrepreneurs should read.
Like I said, I'm really big on lean. I really like Steve Blank, 4 Steps to the Epiphany, the Startup Owner's Manual.
Yep, that's his new one.
Yeah, Running Lean by Ash Mayura. Every title, lean Startup with Eric.
Anything that has lean in it.
Yeah, I just really, lean just really from a design standpoint, it just really makes a lot of sense to me. Also, getting my healthcare education, the healthcare industry has been looking at lean, but they looked at it. They've been looking at it more a traditional kind of manufacturing sense. But the idea is testing and optimizing and always experimenting. And so I like that. And I think just as a business book, The Innovator's Dilemma, that is just the biggest rallying cry I feel for why small businesses and small startups will consistently be able to disrupt the big guys, essentially because the big guys get so big, they focus on the high end of the market. Where are the big money? Where am I getting all my money? The example Clayton Christensen always uses, when Ford and GM were looking at SUVs, and getting all the high-end money from that into the market, Toyota was able to slowly and systematically eat their way up the market, starting from the Toyota Corona, not the Corolla, the Corona, eat away at the Pinto. And, the big guys were like, well, who cares about the Pinto? And then, look where Ford and GM have ended up. The whole question of why didn't Kodak invent Instagram? Why didn't Polaroid invent Instagram? Again, the smaller guys chew away at the edges of the market that the bigger guys don't think matter.
Right.
And then they end up getting caught from behind. And that's something that's really driving me with Happy Health, because admittedly, a lot of physicians, they don't think registration and paperwork is a problem. A lot of people in the industry, they just say, oh, well, the patient portals are going to figure this out. And so that's fine. We're glad that they're kind of looking at it that way, and we sort of have to doggedly, again, take it out from the bottom of the market, low-hanging fruit that the vendors don't care about, etc. So, yeah, definitely, I think those books are big for the industry, for startups.
All right. Well, we're running a little bit over on time, so I guess the last thing is, where can people follow you, Rashad?
You can follow Happy Health at my Happy Health on Twitter. You can follow me directly at Rabdul-Sal, Rabdulsal, on Twitter. I am on Twitter a lot. And on our website, www.happyhealth.me. Come check us out. Check out the demo. Request an invite, and we'll take it from there. I'm happy to talk to people and work with the tech and startup community.
All right. Once again, our guest is Rashad Abdul-Salaam. He's the founder of Happy Health. Thanks for being on the show today, Rashad.
No problem. Thanks so much, Sam.